Cochlear implant is a prosthetic device used to restore hearing. It works by electronically hearing sounds which are converted into signals that are sent to the hearing nerve. There are two main parts to any cochlear implant system. The external component consists of a microphone, a sound processor, and a transmitter. The microphone picks up sounds from the environment. Using advanced coding, the sound processor then converts those sounds into electronic signals. Finally, the transmitter sends those signals to the internal device. Some cochlear implant companies offer a single unit processor, which means that all of the components of the external device have been condensed into a single object. The internal components send the sound signals in the form of electric current to the hearing nerve. The receiver stimulator receives the sound signals from the transmitter and then sends them to the electrode array, which is surgically placed within the cochlea. All of this allows the cochlear implant to bypass the cochlea, which is damaged with hearing loss. During surgery, the internal device is placed completely under the skin, basically becoming part of your body. The external device can be easily removed as needed for activities like sleeping or showering. The internal device is placed during a surgical procedure that takes about 2 hours. It's an outpatient procedure, meaning that you go home the same day. The incision is located behind the ear as shown here. Next, the skull is exposed. The part of the skull that contains the structures of hearing and balance is called the temporal bone. To make a safe corridor to the cochlea, the organ of hearing, where the cochlear implant is placed, the mastoid bone is removed. This bone is located behind the ear canal, shown here. Once the mastoid is removed, a narrow corridor is created into the middle ear, the space behind the eardrum, and from there, the cochlea can be assessed. An opening is made into the cochlea and the cochlear implant is placed. Here you can see the electrode array being placed into the spiral of the cochlea. The tissue and skin are then closed up. Cochlear implant surgery is considered safe and reliable. The device is usually activated with an audiologist a few weeks after surgery. At that point, patients can usually hear sounds, but it takes time for the brain to undergo the process of relearning how to hear. Therefore, patients continue to improve performance with their device for several months and often for several years after the initial activation. Here we are showing the pathway of sound from the piano to the brain through the cochlear implant. The sound moves from the piano to the microphone, gets converted in the sound processor, and transmitted to the internal device. Once the sound reaches the internal device, the receiver stimulator sends signals down the electrode array, and from there it activates the hearing nerve, which relays the sound information to the brain, at which point the sound is heard. We hope you have enjoyed this video created by the Cochlear Implant team and the Skull Base Laboratory at UCSF.